Hello, this is Dr. Neil Baum from New Orleans, and I would like to take about 8 minutes to talk with you about a concept called financial toxicity. This wasn't even on my radar screen until I read an article by Dr. Joyce and Dr. Barakas from Nashville on the concept of financial toxicity, and they were the inspiration for this video. This video will discuss the definition of financial toxicity, the causes of financial toxicity, and what are some easy solutions that we can offer our patients who are facing financial toxicity. Financial toxicity is the economic harm associated with both direct and indirect costs associated with medical care. At the present time, there's very little data on the concept of financial toxicity, and for the most part, it's focused primarily on cancer care. It is estimated that nearly 40% of patients who are newly diagnosed with cancer will deplete their assets within 2 years of diagnosis. So this is a significant problem that our patients who have cancer will face. There are a variety of cancers, and cancers that have different economic consequences. For example, low-grade transitional cell carcinoma of the bladder is not that expensive compared to radical prostatectomy, which can be very costly and lead to financial toxicity. I have provided you with a list of patients who are at risk of financial toxicity, and you will probably recognize many of your patients who fall or have some of these issues that place them at a higher risk of having financial toxicity. The factors affecting financial toxicity is certainly who is going to be the one earning the money in the household, and what kind of debt or assets did they have before the diagnosis of cancer, and how will the cancer affect their ability to continue working and being productive. There is going to be an economic burden on many patients with cancer. There are both direct and indirect costs. Direct costs are usually the costs associated with the treatment, including the insurance premiums and medications. Indirect costs are lack of income, costs of travel and lodging to and from the practices, and from the place where they're going to receive treatment. And there's also psychological consequences, and that is they may have to consider the possibility of bankruptcy. The expected problems associated with financial toxicity may be decrease in income, need to allocate money specifically for ongoing expenses, the consideration for possible bankruptcy, and then the non-medical expenses or indirect costs of cancer care. So the take-home message is that patients with cancer may have a lower quality of life, and they may experience mental anguish and distress, including depression. So what can we do as urologists to help our patients to reduce the risk of financial toxicity? We can begin by asking the patient if the expenses associated with the cancer treatment are going to be a burden for them. It's also helpful if we can direct them to a financial navigator who can help them with their expenses. And oftentimes, this could be someone like a hospital social worker that could serve as a financial navigator. We can connect patients to various support groups. We can suggest that patients contact their human resources and human relations at their work for insurance information. And also, we can offer to them price transparency so the patients know upfront what are their costs regarding treatment. We can offer patients who are experiencing financial toxicity payment options. We can also contact pharmaceutical companies who can provide patients with medication at little or no expense. We also can direct patients to clinical trials, but usually this requires patients who have not had any treatment before they enter a clinical trial. So what's the bottom line on financial toxicity? Financial toxicity is an issue that is going to affect many patients in your practice with cancer. A cancer diagnosis can turn the world upside down for a patient, both emotionally, physically, and I want to emphasize, even financially. A good first step is for us to be sensitive to the issue of financial toxicity and begin a discussion with patients regarding the cost of care for their cancer treatment. I hope you found this video on financial toxicity helpful and useful. If you have any questions, please don't hesitate to contact me at the email address provided on the last slide. Thank you.